Hello, I'm Richard Pinder and I'll be your instructor on this specialisation, Foundations of Public Health Practice from Imperial College London. I'm going to tell you a bit about myself and share some of my experiences from working in public health. I trained as a doctor to begin with. I found myself absorbed in the field of military health while at medical school, looking at the psychological consequences of the wars in Iraq and Afghanistan. I toyed with the idea of being a psychiatrist, but I also considered becoming a radiologist, which was my first degree, or a pulmonologist, which I just thought was really interesting. But it wasn't until my boss suggested I have lunch with a senior doctor in public health that I discovered this fascinating specialty. So I began what we call specialty training here in the United Kingdom. I completed my MPH here at Imperial, quite a long time ago now, and I qualified several years later as a consultant public health physician. That's the equivalent of a board certified specialist in other countries. I've worked in a wide variety of roles. I've worked as a doctor in England's health service, as a senior policy advisor to the Department of Health and Social Care, our government health ministry, in Public Health England, as well as in the private sector, consulting for the pharmaceutical industry. The last 4 years I've spent my time working as a senior public health specialist, running a small team of public health practitioners in municipal government here in London, focusing on healthcare and health intelligence. Throughout all that training and experience, I've also worked part of the time here at Imperial College London, teaching and undertaking research. My special interests in public health are around healthcare, health systems, as well as in education and training. In my role now, I'm responsible for ensuring our medical students and junior doctors understand public health. And I spend 4 days a week here in the School of Public Health, and then 1 day per week in practice, working with practitioners and facing the political and organisational challenges of a modern Western health system. For me, the best thing about public health is the ability to work with really smart, motivated and effective colleagues. I'm hugely fortunate to have a job that I love and a job that makes a difference, whether for our population in my service role or my students in the university. Public health allows me to deal with complex and interesting problems. It allows me to engage and influence politicians, senior decision makers, members of the public, and many more groups. Now, while I'm passionate about public health, it doesn't mean that it's always easy. Public health in government and the health service is a slow game, with occasional wins, but with benefits deferred many months, if not years, into the future. You have to be really patient to do this job, and very resilient to the setbacks that inevitably arise. My 2 top tips for you would be: think broadly. What I love about public health is that it's potentially so broad that I can claim anything as being public health related. Listen to the radio, watch the news, and you'll only broaden your context and understanding of public policy, and how all of these complex drivers and mediators interact. My second tip is take part. If you engage in the opportunities we've set up on this platform as part of this specialisation, you'll learn from your peers as much as you learn from me and the teaching team. So I'll be your guide as you undertake this exploration of public health. Join us and learn about the foundations of public health practice.